Hello, I am Vidyut Bhattacharya. Good morning to everybody. Today I would like to talk about the autoacoustic emission, which is nowadays most widely used all over the world. And basically in the Western countries, it is used as a screening tool in schools, hospitals, and then the nursing homes, and in all medical health institutions. So it is a very useful tool, autoacoustic emission, for screening of newborn babies and take early intervention programs. So what is autoacoustic emission? So it is a very small instrument like a drilling machine where we give one sound from the ear probe and it placed in the ear canal, and it will go to the cochlea, and the cochlea will revert it back the sound to the microphone, and it is recorded in a system, and it is called the autoacoustic emission test. So it takes usually 30 minutes to administer the autoacoustic emission tests. So the basic criteria of doing these tests is we have to ensure the patient's external auditory meatus or the external auditory canal should be intact, and the middle ear system also must be intact. Otherwise, the test result will be affected because the sound will be transduced to the external auditory meatus and through the middle ear system and then go to the cochlea. So it is basically to give a cochlear sound. So what is the mechanism of autoacoustic emission? Because in autoacoustic emission we give the response of the outer hair cells of the cochlea. Because as you all know, that in the organ of porta in the cochlea there are two types of hair cells, outer hair cells and inner hair cells. So the outer hair cells vibration, outer hair cells movement will be recorded in the system. So we know that cochlea is functioning or not in that case. So that's why it is called the basic screening test for hearing. In case of newborn also, even the baby born today itself, we can do the test for ensuring the cochlear function of the baby. So it is most widely used nowadays in the Western countries, in all hospitals, normal schools, clinical setups, and medical institutions. And we will appeal to our government of India also to administer this test or to provide this instrument in all setup for hearing screening, because it is very important for early intervention in case of even the baby born today or the newborn screening for better conservation of hearing for the future purpose. So it actually done in 3 ways. So one is called simultaneous stimulation, then number 2 is called OAE, transient autoacoustic emission, and number 3 is DPOAE, distortion product autoacoustic emission. So what happens in case of simultaneous stimulation? There will be no external stimulus, external sound will be given. So automatically the cochlea will revert it back the sound, and it will be recorded in the graph. So in case of transient TOAE, transient autoacoustic emission, we will give one frequency sound in the range of around 500 to 6 kilohertz or to 4 kilohertz. So then it will be recorded in a graph. So the cochlea will revert back the sound, whether cochlea is functioning, the hair cells are moving or not. It will be recorded in a graph. It's called TOAE. And GPOAE, what happens, there are two stimulus, two frequency sounds simultaneously presented through the external auditory meatus with the help of probe. So there will be distortion in the hair cells. So accordingly, there will be two types of sounds will be reverted back from the cochlea. So it is also given again in the range of 500 to 8,000 hertz in the range of frequency range. So these two, these three methods we can get the idea about the function of the cochlea. It is basically, I told you initially, that it is a screening instruments only. So we cannot go for the further estimation of hearing. So if you would like to know about above the cochlear level or in the brainstem level, you should go for other higher investigations like ABR or tympanometry and all those things. So the difference between the acoustic reflex and the OAE measurement is the OAE is giving only the outer hair cells response, and acoustic reflex that we get in tympanometry or impedance audiometry, that is giving the inner hair cells responses. So it gives more deeper information, like if there is any pathology above the cochlear level or the auditory cortex level. So we can get the difference between this. So as a professional audiologist, we will just get the idea about the cochlea is working or not, because the hair cells are automatically moving inside the cochlea, the organ of corti. As you know, the parts of the organ of corti, the semicircular canals, and there are endolymph and perilymph, and there are liquids like sodium and potassium all are moving inside the cochlea. So the hair cells are also moving simultaneously. So autoacoustic emission is nothing but a sound generated by the cochlear outer hair cells automatically due to the movement of the hair cells. So it is very nice and very easy way to screen the hearing clear status of the child. So it is useful nowadays in all normal schools, in hospitals, in clinical setups, in educational institutions like medical college, and for I am just presenting today, it will be helpful for the undergraduate students and the postgraduate NTPG students which are undergoing their study. So autoacoustic emission is a very important nowadays and basic screening tool for cochlear assessment. We can get basically the idea about the cochlea is working or not, but not beyond that. So if you go for deeper study, you have to go for some other higher level investigation like ABR or tympanometry or other hearing investigation. So I would like to thank you all for listening me for this presentation today. It's a little or very brief interpretation for the purpose of our professionals as well as the students who are undergoing this audiology and speech pathology, or the postgraduate ENT students, those who are working in different, studying in different medical colleges for their knowledge. So thank you all. So I would like to request about your suggestions for further research purpose. And thank you all. Good morning to you all.